millions of seniors are cutting salt and still seeing dangerous blood pressure numbers that increase the risk of stroke and heart attack. What most people don't realize is that 3 simple foods can lower blood pressure as much as what researchers sometimes see with low-dose medications, and most seniors aren't eating any of them consistently. I'm Dr. Mandy Thomas. Today, I'm covering all 3, exactly why each one works, how much you actually need, and the simplest ways to build them into your daily life. High blood pressure is called the silent killer for a reason. Most people feel completely fine until a stroke or heart attack happens. This is exactly why cardiologists often recommend these foods alongside medication, and why understanding them matters for every senior managing blood pressure. Let's get into Food 1. Food 1, berries. The science behind why berries lower blood pressure comes down to a class of compounds called flavonoids. Flavonoids stimulate the production of nitric oxide, a natural signaling molecule that tells the smooth muscle in your artery walls to relax. When those walls relax, the diameter of your blood vessel increases. More space means less resistance to blood flow, and blood pressure drops. Here's a simple way to picture it. Imagine squeezing water through a narrow garden hose versus a wide one. The pressure required to push the same volume through the narrow hose is significantly higher. That's exactly what's happening when your blood vessels are tight and constricted. Berries push in the opposite direction by triggering that relaxation response. Studies tracking people who consume 2 to 3 generous handfuls of blueberries daily found systolic blood pressure dropped by up to 7 points over a couple of months, comparable to what researchers sometimes see with low-dose antihypertensives. And the effect is even more significant for seniors because arterial walls naturally stiffen with age, and the nitric oxide pathway berries support is one of the most direct ways to counter that stiffening. One of my patients in her 70s started adding berries and flax to breakfast every day. Within 2 months, her readings had dropped enough that her doctor decided to delay starting medication. Same person, same lifestyle otherwise. 2 simple additions to breakfast. How to build it in. Swap your current dessert habit for berries with Greek yogurt, satisfying the sweet craving while getting protein and flavonoids at the same time. Keep frozen blueberries in the freezer at all times. Frozen retains nutritional value extremely well. Rotate through dark berries, blackberries, cherries, raspberries. The darker the berry, the higher the flavonoid concentration. Drop a comment right now. Have you ever changed your diet specifically for blood pressure? Yes, no, or curious? I want to know where you're starting from, and there's something most doctors only spend about 30 seconds explaining that makes these 3 foods even more powerful. The most underrated lever for blood pressure is body weight. For every kilogram of body fat lost, about 2 pounds, blood pressure drops by approximately 1 point. Lose 10 pounds and your systolic can fall by around 5 points. 5 points can be the exact margin between a reading being monitored and one where a doctor starts discussing medication. These 3 foods do 2 things simultaneously. They work directly on arterial walls to help blood vessels relax and widen, and they support healthy weight because of their nutritional profiles. Double benefit from every serving. That's why the research on these foods shows such impressive results. Food 2, and this one shocked researchers when the data came in. The second food is actually the most thoroughly studied for blood pressure in clinical research, and most seniors are either not eating it at all or eating it in a form that barely works. Ground flax seeds. Flax seeds contain 3 separate blood pressure mechanisms in one food. Omega-3 fatty acids with anti-inflammatory effects on blood vessels, soluble fiber that supports gut health, weight management, and has independent cardiovascular benefits, and polyphenols, specifically lignans, with antioxidant effects that contribute to arterial health. A 2022 clinical trial had participants consuming 30 grams of ground flax seed daily, roughly 2 tablespoons, for 3 months. Systolic blood pressure dropped by 13 points, diastolic by 5. 13 points is not a minor adjustment. That's the kind of change that moves people from hypertensive back into a normal range. A large 2024 meta-analysis confirmed these benefits specifically in people diagnosed with hypertension, finding average drops of 8 to 9 points systolic. Here's what most people eating flax seeds are doing wrong. Whole flax seeds can pass through your digestive system without being properly broken down. The hull is tough enough that your gut sometimes can't crack it open, meaning the beneficial compounds travel straight through without being absorbed. Ground flax seed doesn't have this problem. At the store, look specifically for ground flaxseed or flaxseed meal. Store it in the refrigerator after opening. The omega-3s degrade at room temperature. Stir 1 to 2 tablespoons into morning oatmeal. Blend into smoothies completely undetected. Stir into yogurt. 2 tablespoons daily is the target. I want to pause here. If you're over 60 and want science-based heart health advice every week, subscribe now and turn on notifications. And share this today with a senior you care about managing blood pressure. Now let's get to food 3. Food 3, and this one might surprise you because most people already have it in their kitchen. Garlic has been used medicinally for thousands of years, and now we understand exactly why it works. Garlic is a natural vasodilator. Like berries, it increases nitric oxide production, signaling smooth muscle in your artery walls to relax. But it also contains sulfur compounds that directly influence blood vessel tone through additional pathways. Studies show reductions in systolic blood pressure of up to 8 points in as little as 10 weeks. And here's the preparation detail almost nobody knows, and it makes a real difference. When you crush or chop a garlic clove, it triggers a chemical reaction that produces allicin, the primary active compound responsible for garlic's blood pressure effects. But that reaction needs a few minutes to complete. If you crush garlic and immediately throw it into a hot pan, the heat deactivates the enzyme before allicin reaches meaningful levels. The fix? Crush your garlic and let it sit for 5 to 10 minutes before it touches any heat. Dosage: roughly 3 cloves of fresh garlic daily, or about half a teaspoon of garlic powder. If 3 cloves feels like too much, odorless garlic capsules provide some benefit, though fresh garlic remains the preferred route when practical. Here's the bigger picture. These 3 foods operate through different mechanisms. Berries through flavonoid-driven nitric oxide. Flax seeds through omega-3 anti-inflammation, fiber, and polyphenols. Garlic through allicin-driven nitric oxide and direct sulfur compound effects. When you're consistently consuming all 3, you're targeting your cardiovascular system through multiple distinct pathways simultaneously, which explains why the combined dietary approach produces far more significant results than any single change in isolation. Quick summary. Berries: 2 to 3 handfuls of dark berries daily, up to 7 points systolic reduction. Replace desserts with berries and Greek yogurt. Ground flaxseed, 2 tablespoons daily, up to 13 points systolic reduction. Buy ground or milled, refrigerate after opening. Stir into oatmeal, yogurt, or smoothies. Garlic, roughly 3 cloves or half a teaspoon of powder daily, up to 8 points systolic reduction. Crush and wait 5 to 10 minutes before cooking. Consistency is what turns these from interesting facts into actual changes in your morning readings. I've put together a free blood pressure food cheat sheet, a 1-page printable you can keep in the kitchen with the exact servings, preparation tips, and the simplest daily habits for all 3 foods. Many of my patients print it and stick it to the fridge. The link is in the description, originally created for my clinic patients and available here for now. Drop a comment below. Which of these 3 are you most likely to start with? I read everyone. Subscribe if you haven't. Share this with a senior you care about who's been stuck in the salt restriction mindset and missing these far more impactful strategies. Next video, the 5 supplements with the strongest clinical evidence for blood pressure reduction and how they interact with these dietary changes to amplify the effect. I'll see you there. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making significant dietary changes, especially if you're on blood pressure medications or blood thinners.